Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Philippine Red Cross seizes its free coronavirus testing for OFW and frontliners as the Philippine Health Insurance Corporation, or PhilHealth, fails to settle its debt. Also, PhilHealth launches its probe on healthcare providers and individuals allegedly involved in corruption. And will its new leader meet the president's deadline in cleaning up the agency? PhilHealth President and CEO Dante Gierran joins us live. Malacanang apologizes to the Philippine Red Cross amid the unpaid dues of PhilHealth to the organization. National Task Force Against COVID-19 Chief Implementer Carlito Galvez says NTF Chairman Delfin Lorenzana, PhilHealth Chief Dante Gierran, and PRC Chairman Senator Richard Gordon are already discussing the issue. In a statement, PhilHealth says it is now in close coordination with the PRC. Yesterday, the PRC halted its coronavirus tests that are being charged to PhilHealth because of the agency's failure to settle its increasing outstanding balance.
Sa ngayon po, ang ginagawa po natin, ang strategy po natin, meron po tayong mga high capacities na, testing laboratory. So, inapuna po natin na sa JB Lingad na mataas po ang capacity niya ng 4,500 na temporarily, kung just in case magkakaroon po ng pagpigil ng testing po ang Red Cross ay sa kanila po muna sa Lung Center at saka dito po sa area ng Lingad at ang mga RITM yung gagawin po natin na ibibigay yung ating mga testing samples sa OFW. Sa ngayon po, inaayos po natin ngayon and I'm confident that the issue will be resolved immediately.
Mm-hmm. The government estimates that the impact of Red Cross stopping its PhilHealth-based swab testing will mostly be on overseas Filipino workers, but Malacanang says there's no reason for OFWs to worry because other testing facilities are available. Let's go straight to the source of this story. We have PhilHealth Chief Dante Gierran. Attorney Gierran, good morning, sir. Welcome to the source and thank you for your time.
Good morning, Madam Pinky. And of course, to the other guest, I heard my idol, General Galvez, and the rest of your guests, and of course, to your other listeners.
Attorney Gierran, Secretary Galvez had said that Secretary Delfin Lorenzana, Senator Richard Gordon, who is PRC chair, and yourself are already in close coordination. But let me start with this, because the point of this right now is really Red Cross is stopping its PhilHealth-funded COVID-19 tests because of, they say, payables amounting to about 930 million pesos. Number one, sir, is this accurate? And if so, paano umabot ng ganitong kalaki ang utang ng PhilHealth sa Philippine Red Cross?
Well, that's correct. The Philippine Health Insurance Corporation is, at the moment, indebted to PRC, Philippine Red Cross, that amount. Not because that we don't want to pay, but we want to pay. Only that we have to clear some legal issues affecting the memorandum of agreement that was entered earlier between the management of PhilHealth and the Philippine Red Cross.
What are these legal issues that you're talking about? Meron ho bang agreement in the contract? Is there anything in the contract that is questionable, sir, to you?
Well, there is an agreement in the contract that the PhilHealth is seeking the assistance of what we call this PRC, the Philippine Red Cross, for its for COVID testing, and of course this was entered before I came in, and the contract, the MOA, was actually entered between PRC or Philippine Red Cross and the previous management of PhilHealth by virtue of the Bayanihan to Heal as One Act and the subsequent directive from the very good office of the Executive Secretary. Only that in that rather direction, the implementing we call it implementing emergency measures under Republic Act number 11469. But the PhilHealth was also directed to abide by the rules on procurement, which something that my legal team at the PhilHealth didn't say about it. We haven't seen compliance with that directive of the Executive Secretary's office, and even in the board resolution of the PhilHealth, where no less than the Secretary of Department of Budget had indicated its instruction to PhilHealth management to abide by the provision of the procurement law.
Mhm.
And
Opo.
what is important here also is one of the board of directors of the PhilHealth, including one of the lawyers of the PhilHealth, inside lawyers of the PhilHealth, it's Antonio Pineda, had raised the issue about the infirmity itself in the MOA, the memorandum of agreement entered into by the previous management of PhilHealth and the PRC or the Philippine Red Cross.
Okay. Attorney, I hope you don't mind my saying, sa madaling salita po, ano po ang issues na nakikita niyong problematic? Because that's what I'm trying
Yun nga po.
to, that's what
Yun nga po,
I'm
para sa
deducing
kalaman ng
from what
ating
you're
mga
saying,
kabayan.
sir.
Merong utos doon. Kahit naman doon sa directive ng ating Executive Secretary, and also the board resolution that actually ratified the contract between PRC and PhilHealth na kailangan na sumunod doon sa regulasyon ng procurement law.
Mhm.
Something po na
So-
hindi nakita na aking legal team dito sa mga papel dito sa PRC. And so, Pinky,
So, ano po,
the right
Sige po, sir, go
thing
ahead.
for me to do, thing for me to do is to be prudent. By prudent, I have to seek the opinion of the Department of Budget. And up to this point in time,
Okay.
we are still waiting for that opinion, Pinky.
okay, sir, ang sinasabi niyo ho, tila doon sa kontrata, merong hindi mga nasunod. Okay, can you be specific, sir? Ano ho ba sa kontrata ang tila hindi nasunod, kaya't you decided to be prudent and seek advice or any recommendation from the DBM? Ano ho yung nakikita ninyong problema?
Yun nga, yung pagsunod sa batas ng Procurement Act. And gusto ko lang ipaliwanag, dahil nasa emergency tayo, and doon sa Bayanihan to Heal as One Act, merong provision doon na the what we call this, parang there should be a negotiated emergency bidding for that matter. Pero kahit na, Pinky, doon sa sinasabi na negotiated, ay meron pa rin mga requirements. Isang requirement doon na i-publish ang naturang transaction doon sa portal ng Government Procurement Policy Board, GPPB. ang GPPB ay primary authority on government procurement. And then the PhilHealth also has to publish the contract in the PhilHealth website, or absent for that in any conspicuous place, indicating the following: yung pangalan ng project, yung contract price, and some others. Something na hindi namin, something that my legal team did not see in the documents at the PhilHealth.
So you're seeing problems in the contract, sir. Entered into
Yes,
by the
ma'am.
previous president, of course. May nakikita, yun po malinaw, may nakikita po kayo sa kontrata na posibleng irregular. Meron po kayo nakikita sa kontrata na posibleng hindi nasunod.
That's right, ma'am.
Okay. But it's still not clear to me, attorney, I hope you don't mind, ano ho ba talaga dun sa kontrata yung hindi nasunod in terms of procurement? Kasi may sinabi ho kayo na merong hindi nasunod sa procurement. Meron din po sa emergency bidding. Yung something that we can understand, sir. What was in the contract that you found questionable or hindi po nasunod?
Yun nga po, Pinky.
Which part of the procurement, sir?
Yung project, yung una, yung condition na binigay ng Board of Directors ng PhilHealth for PhilHealth management to follow the rules of procurement. And then the rules of procurement, even under the emergency purchases, ay merong sinasabi na it has to be published, it has to be at the portals of the government procurement policy, yung pangalan kung sino, of course pangalan ng ng PRC, the amount and the rest. So yun ang hindi po nasunod, Pinky. And that is jurisdictional, no matter where you go. Kasi ito, Pinky, klaruhin ko sa lahat. The moment that government's money is being transferred to a private hand, it should be regulated by the procurement body. And all money, sabi ko, involving transfer must be regulated by that procurement body or procurement law. It's not enough that there is a directive for us to do this, and then we will not protect, we will not make safety nets for the disbursements of all this money. Otherwise, I will be committing another round of imprudence, just what happened to previous management, and something that I will not do at the moment.
All right. Attorney, we just need to take a very short break, sir. We're going to be right back. You're watching The Source on CNN Philippines. Our guest today, PhilHealth Chief Dante Gierran. So, Attorney Gierran, to simplify it, you're saying that the rules of procurement were not followed. Is there any issue here, Attorney Gierran, on possible bidding? Meron ho ba kayong nakikitang problema na should it have been a public bidding or may hindi po nasunod, may na-violate?
One thing is your Pinky. This is a negotiated emergency negotiated procurement.
That's right.
Yung sa regular, in the regular procurement, what is required is competitive bidding,
Public.
which should be rather relaxed under the emergency procurement bidding. But then, even if it is being relaxed, there are still requirements to be done. Yung sa sinabi ko na, na may publication doon sa portals ng Government Procurement Policy Board, and it has to also be published in the website of the PhilHealth, or absent that, any conspicuous place, indicating the following pangalan po ng kakontrata, amount ng kakontrata, when it started, and the rest.
Okay. Okay, I understand what you're saying, sir, now. So now that you're looking into this and seeking the advice also of the DBM, are you telling us that questionable po na babayaran ng PhilHealth itong 930 million? Or, in spite of this, sir, PhilHealth, rather Red Cross, can be assured that the payables of 930 million will be paid?
Ay, ano, one thing, one thing also, Pinky, is certain. May utang po ang PhilHealth sa Red Cross, Philippine Red Cross. We recognize the help of Philippine Red Cross to the government, particularly our brothers, victims that are to be tested with COVID. And one thing is sure also that we will pay for that, Pinky. Regardless of whether the DBM will assume a negative position on the matter, meron naman tinatawag, Pinky, na quantum merit. Babayaran talaga ng PhilHealth yan. We have money for that. We have to pay for that. We are indebted to PRC. And we recognize the support, the help of PRC. Senator Dick Gordon is our friend. We have got in touch with him and other officers of the PhilHealth the other day, for that matter.
Okay, attorney. Okay, so siguradong babayaran. Ang tanong ko na lang po, sigurado bang ang babayaran ay 930 million pesos na sinasabing utang?
May ano kasi yan, Pinky. May mga rates yan, no? May rate na before I came na 3,005 kada isa ang testing. And then, because of the decreasing cost lately, umabot na lang ng 3,409. And this because we have coordinated with, and even we made a meeting together with my boss, Secretary of DOH, and Senator Gordon and the rest of his team, na binaba po ang bayad from 3,005 to 3,409.
Okay. Attorney Gierran, sir, we need to take another short break. The Source will be right back. You're watching The Source on CNN Philippines. Our guest today, PhilHealth Chief Dante Gierran. Attorney, we only have 5 minutes left. I will try to ask my questions as quickly as possible, and I hope you can also answer them briefly. In summary, ang sinasabi niyo, siguradong babayaran ang Red Cross, pero posibleng mas mababa dun sa 930 dahil dun sa 3,500 na test ay nagmura na ito ng about 3,400 pesos. That's correct, no, sir?
That's correct.
Okay. Sir, I want to talk about this, the investigation on healthcare providers. Of course, nagkaroon na po ng profiling nito as stated by one of your team members there in PhilHealth. No? Just can you give us an update dito sa healthcare providers? Ilan na ho ang nakita niyong posibleng fraudulent? What kind of sanctions do they face?
We had, the NBI had already filed 3 cases against healthcare providers. These 3 healthcare providers are situated in Zamboanga del Norte, in Coronadal, and one in Davao del Norte. Apart from the case that was filed by the NBI as a task force against the officers of PhilHealth on the IRM. So 3 na po ang na-file ng about a week ago po. And all this involves the very issue or the very core of the alleged fraud committed against PhilHealth, involving yung tinatawag nila na up-casing, up-coding, up-billing, and the rest.
Okay. So patuloy po itong investigation on possible fraudulent, irregular healthcare providers. Now, how can what are you doing? What is your office doing right now to be able to address this problem? Because from my understanding, sir, you have thousands of backlogs on cases of upcasing, sir, and the like.
To be exact, there are 7,500 backlog cases at the central office, but it's not only about upcasing. It may be other cases also. And it is being, right now, I ordered the legal office to dispose of those backlog cases. Some of those backlog cases, sabi nila, about 1,000 of those backlog cases are for only report writing. Report writing lang po.
Okay. So, last question, Attorney Gierran. Ang sabi po na Pangulo, gusto niyang malinis ang PhilHealth by the end of the year. Palagay niyo ho ba matutupad itong inyong tungkulin na linisin ang PhilHealth by the end of the year?
Ma'am, that's a very hard job, no? You know, this alleged frauds, no? Existed long time ago, and this cost something like 150 billions according to the report of the CUA. And then I am here just about one month ago, and I'm giving the president up to December to cleanse PhilHealth. Ito lang masasabi ko, ma'am. If I can only create a dent on those corruptions, alleged corruptions at that in the PhilHealth, then I will be happy and go back to my hometown happy.
All right. I'd like to thank you. Sir, pasensya na po, naubusan tayo ng oras. I hope we have a part 2. There's still so much to talk about. There was a COA report also on the release of hazard pay and sana yung IT project. But let's just have a part 2. PhilHealth President and CEO Dante Gierran. Sir, maraming salamat po sa inyong oras.
Thank you also, Pinky.
And before we go, we would like to thank the Asian Academy Creative Awards for recognizing The Source as this year's Best Current Affairs program in the Philippines. The Asian Academy Creative Awards is a yearly competition that recognizes works of creative excellence across 16 nations in the Asia Pacific. It's an honor that The Source has been chosen to compete with other Asian entries in the finals this December. But even more so, we are already grateful to have been given the chance to represent the Philippines in the international stage. We would like to dedicate this award, of course, to our viewers, our guests, the rest of the show staff, and the entire CNN Philippines team. This award inspires us to do better in bringing you in-depth conversation to help you make informed decisions. Again, thank you to the Asian Academy Creative Awards. And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.